You're listening to the MotherToBaby Podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. Also, quick disclaimer. The opinions shared by our guests are their own and don't necessarily reflect the views of Otis MotherToBaby. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a MotherToBaby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the MotherToBaby Podcast. My name is Chris Stallman, and I'm a genetic counselor, a mom of four, and a teratogen information specialist. So what that means is that I talk to people, so patients, their family members, and healthcare providers, about exposures that can happen before pregnancy, during pregnancy, while breastfeeding, and in cases of adoption. An exposure can be anything. So it could be a chemical that you work with, a medication that you take, or a food that you eat, something that you have questions about either before, during, or after pregnancy, or while breastfeeding. On today's show, we have Dr. Judy C. Morrow from Harvard Medical School here to talk with us about the FDA and the REMS programs. Dr. Morrow, welcome to the show.
Thanks, Chris. You can call me Judy, please.
Thank you. So, Judy, can you tell me and the audience a little bit about yourself and your role?
Yeah, Chris. So I'm a researcher. I work primarily with insurance claims data, and I work primarily to look for adverse events that happen after someone takes a medication. And I do a lot of my work in pregnant populations and looking at the effect on not only the mom, but also the baby. So it's a perfect fit for today.
That's awesome. Can you tell us a little bit more about what an adverse event is?
Sure. An adverse event is basically an unwanted event or an unexpected event that might occur to somebody after they have taken a medication. And so a good example of that for the program today is having a birth defect, which is, of course, a very unwanted event and one that we seek to try to avoid by making pregnancies healthier, by knowing something about the meds that people take while they're pregnant.
Awesome. Can you tell us what is a REMS program and why do they exist?
Sure. So REMS stands for Risk Evaluation and Mitigation Strategy. And this is something that came into being in 2007 through legislation. And it empowers the Food and Drug Administration to require manufacturers of products. So this is, when you see commercials for drug products, This is what I'm talking about. So it allows the FDA to choose to ask a manufacturer to do more to try to protect pregnant women beyond what is in the label. Mm-hmm. So you can think of like when anybody goes to get a medication at a pharmacy, the label is considered sort of like the first line of defense. Mm-hmm. But I don't know if you've looked at a label lately, but they're very long, they're very complicated.
Yeah.
And the patient prescribing guide is all the way at the end of the label. Mm-hmm. So you're 50 pages into the document that you might get handed at the pharmacy. Wow. When it tries to address to a patient what that means. And oftentimes there's a concern that the adverse event like a birth defect is so important to avoid that you need to do something beyond just have a label. And so then the FDA can choose to require a manufacturer to do something extra. And that extra thing can be something like make a medication guide, which also can be in the label, which is intended to be meant for patients. It's not meant to be read by doctors. It's meant to be read by patients. That's sort of the simplest. And the idea is to share knowledge that, there has been evidence, for example, that this product can cause birth defects. That's sort of the basic sort of knowledge sharing. But if there's enough concern, they can add parts to the program that actually are intended to provide a higher threshold before you can actually get a medication at the pharmacy.
Okay.
And those might include ensuring that the pharmacist is specially certified to dispense this medication, to give it out, that the provider is especially certified to prescribe this medication. And one of the most sort of one of the biggest additional things that it can do is it actually can require people to show evidence of having negative pregnancy tests.
Sure.
To ensure that when they receive the medication, they believe they are actively not pregnant. And then when they receive that medication, they might only be allowed to fill it for 30 days at a time and no refills without having a subsequent additional pregnancy test. So at sort of the highest level, there's just a real effort to ensure that women are not pregnant when they receive this medication, all in the service of avoiding birth defects.
Absolutely. Thank you for that. What's an example of a medication with a REMS program that is especially relevant to pregnancy?
So usually the medications that get REMS programs are not necessarily chosen because they're especially relevant to pregnancy, meaning, like, for example, a lot of pregnant women take antiemetic drugs, something that prevents nausea and vomiting. But really, the key feature of some of the REMS programs we're talking about is that they have evidence with animal models or some other source that they cause birth defects. So one of the most stringent REMS programs is for a drug that's called isotretinoin, which is an acne medication. Its brand name is Accutane, but now it's been generic for a very long time, so it has a lot of different names. But the idea there is that that acne happens often to women of childbearing age, and that it's something that there's differing sort of opinions on how severe it is. There are a lot of folks who think, well, really severe acne can cause self-esteem issues and mental health issues and things like that. But there is a risk-risk trade-off there. And the idea is, well, if a person is taking this acne medication, really, there's no world we live in where taking that medication would be worth taking the risk of getting a pregnancy that then is potentially has a birth defect. And so the idea here is really prevent that pregnancy, and that is the medication that's an example of the medication that has the requirement for negative pregnancy tests, the requirement for continuing to show that you are not pregnant while on this medication, the requirement that the prescriber have special training, the requirement that the pharmacy have special training. So there's a lot of things that go into basically trying to prevent exposed pregnancies.
How does the FDA work with healthcare providers to ensure that REMS strategies are executed correctly?
So actually, the FDA doesn't work directly with providers. Instead, they work with the manufacturers of these products because those are the people to whom they can issue this requirement that they have to have a REMS.
Got it.
So it's actually the manufacturers that are required to show compliance with what they have put into the REMS. And those are done with these things called assessments. And assessments happen throughout the life cycle of when a REMS is initiated. And then the idea is that it's checked up on as you go. And so you can check up on things like process-based. For example, do all the pharmacies that you allow to dispense your product, is all the training there? Do you have records of all of it? Do you have records of all of the prescribers having the training? Things like that. And so they will require that the manufacturer provide evidence and data to show that they have done these steps. And then additionally, they ask folks like me and others to monitor the available data sets that we have to look to see, are we actually seeing reductions in the number of exposed pregnancies? And really the big thing that, is a concern is the people who find themselves incidentally pregnant. They weren't intending to get pregnant while on a drug, they become pregnant. And so looking at the available data to try to ensure that this program is effective, that essentially we're preventing those pregnancies from happening.
And that can be a little bit tricky when you think about, the rate of unplanned pregnancies in the United States is, approximately 50%. There's a lot of potential there, and it's starting to fall into place in my mind why you would want something like, you said the negative pregnancy test, right? I believe it's called the iPledge program.
It is.
For the Accutane and, the generics as well. And it's an interesting thing, right? Because it does seem very restrictive, but again, knowing the reason behind it makes a lot of sense. And the effort to try and prevent those exposed pregnancies.
Yeah, I mean, it's not to say that I think a lot of people feel that it is an inconvenience, and certainly it's difficult because you have to go through and get those frequent tests and demonstrate that you still are not pregnant to continue to take this medication. And so I think, though, that the idea behind the REMS is that, again, the concept of this is that the label isn't enough to prevent the unwanted occurrence from happening. We have to do something more.
We need more. Absolutely. And I appreciate, again, that effort to try. And again, what we're all here in the maternal child health space to do to optimize those outcomes and hopefully have the best outcomes for the fetus, for the person who is pregnant, and, across the life cycle. So what should a patient know if they are prescribed one of these medications that is followed by a REMS program?
So some of the programs, for example, the iPledge program, which is one of the more restrictive of the REMS programs, will actually require patients to enroll in the program in order to be dispensed medication. But there are other medications where enrollment is not required, but there is a registry that exists, which, like, some of the MotherToBaby is associated with pregnancy registries. There's a number of pregnancy registries where the idea is to monitor the pregnancy and understand the impact of the medication while a person is pregnant, and to continue to follow that pregnancy to see if there's been a healthy mom outcome and a healthy baby outcome after the pregnancy is completed. And so I think that with all of these medications, there is a request to the patient to enroll in these registries to continue to monitor them. But then additionally, they might just be aware that they might have to have an extra counseling session with their pharmacist when they prescribe the medication, because they might say, we have, a couple of extra things we need to talk to you about before you take this medication and things like that. So they might expect that there is a higher level of interaction with the healthcare system than, for example, if you're going to pick up, dispensing of a Z-Pack because you got, a flu type, situation, or, some sort of bronchitis or something. So.
Excellent. Well, Judy, before I let you go, is there a final thought you would like to leave our audience with?
I think it's just to say that these programs are actually in place for perhaps fewer drugs than maybe people, might think they ought to be. I mean, honestly, the number of programs that are in place it's a small number. And part of that, I guess I'd say, is because so much about medication use during pregnancy, we don't have good data for, because pregnant women are typically not involved in clinical trials. And so all of that information is learned about by doing what I do, which is monitor data that happens after a drug is already on the market, and people interact with the healthcare system, or from these registries. And so I think one of the things to consider is that there might be other drugs that are actually, have just as much of a danger, that don't have a REMS yet, or don't have enough data yet. And part of that is just because we don't know yet, but it's something to, be aware of, that the absence of a REMS doesn't necessarily mean that the product is not a teratogen, if that makes sense.
Absolutely.
So it's not like proof that, the product we 100% know what happens when it's taken during pregnancy. So,
right, because sometimes we don't know yet.
Sometimes we don't know yet
what the outcome could be.
And so it's not to say that people shouldn't have a good conversation with their doctor about these medications. And obviously, when people have a planned pregnancy, it's something that is probably a part of all the conversations they have. But really, a lot of what we're talking about here is trying to prevent complications that arise from an unplanned pregnancy when they may not be even aware that they're pregnant while they're exposed to a particular medication.
Absolutely. So what I took from that is communication is key. And having those conversations, like you said, with the prescriber, with your provider, with the pharmacist, that's a great way to get the information that you need for hopefully your best outcome.
Yeah.
Excellent. Judy, thank you so much for being here with us today. This is absolutely amazing information. Thank you and to your colleagues for the work that you do. Again, trying to optimize those outcomes. It's, I'm sure it's challenging work, but I don't have to tell you how incredibly necessary it is. So thank you.
Thanks, Chris. It was so great to be here.
And that's going to do it for this episode of the Mother to Baby podcast. Be sure to hit that subscribe button so that way you never miss a new episode. You can go back and listen or re-listen to some of those older episodes as well. You can find us on iTunes, Spotify, Audible, or however you like to listen to podcasts. If you want to be on the podcast or if you have an idea for the show, we would love to hear from you. Please feel free to email us at contact@mothertobaby.org. And Mother to Baby is here to answer your questions about exposures before and during pregnancy, while breastfeeding, or if you have questions about exposures and adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525. You can visit us on our website, MotherToBaby.org, and there you can chat with an information specialist. You can look at our many blogs, information pages, our hundreds of fact sheets that are available free in English and in Spanish. And you can also listen to our podcast or find out how you can participate in our pregnancy studies. If you would like to support the Mother to Baby podcast, as well as all of the ways we get critical pregnancy and breastfeeding health information to you at home, we have a new way to do just that. Encircle is our new monthly giving society that helps ensure we can continue to provide our services at no cost. Join the community today and encircle parents and babies in health. Members will be recognized on the podcast and website. Mother to Baby would like to take a moment to thank our very generous donors who help support the important work that Mother to Baby does. Jason Alexander, Emily Gravelet, Chad Haldeman Englert, Lori Harris Sagetabai, Jamie Hung, Beth Kiernan, Kendra Kramer, Nevina Christic, Ruth Moss Katznelson, Sarah Obachan, Kirsty Parada, Alfred N. Romeo, Anna L. Taylor, and Elizabeth Wasternack. Thank you all for your generous support. And if you're interested in becoming a donor, be sure to visit our website at mothertobaby.org. Until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.